Hello everyone, I'm doing Mark in interview. I will talk about two goals. The first goal will be, um, Isabel will identify at least three. First, I'm talking about the Kylan call. Isabel, uh, her age is gonna be 32, born in 1992. So we will go ahead and go to objectives. Isabel will identify at least three early warning signs of her anxiety and implement one coping strategy. Example, deep breathing, mindfulness exercise when these signs are detected. Interventions, psychoeducation on anxiety, providing information about the nature of anxiety, physiologically and psychologically symptoms, and common triggers. This will help Isabel normalize her experience and understand the mind-body connection. Frequency. Addressing acute distress, Isabel is experiencing significant distress with physical symptoms and work-related difficulties. Weekly session allow for consistent support, immediate intervention for acute anxiety, and a safe space to process overwhelming feelings. Target date. Months 1 to 2 initial phase focus on establishing rapport intensive psychoeducation, introducing and practicing foundational coping skills, mindfulness, deep breathing, and beginning to identify anxious thoughts, patterns. The primary aim here is stabilization and skill acquisitions. Isabel will report subjective decrease in anxiety symptoms by at least 2 points. Example on 0 to 10 scale by at least 2 points and demonstrate understanding of at least two relaxation technique used to manage acute anxiety. Mindfulness stress reduction technique use. This is when we talk about the interventions. Mindfulness-based stress reduction technique use, teaching and practicing technique use such as deep breathing exercise, body scans, and guided meditations to help Isabel become more aware of her present experience without judgment. And this will be when we talk about the frequency. Skill building. The plan involves teaching new coping mechanisms, cognitive restructuring, and assertiveness skills. Regular weekly practice and reinforcement are essential for these skills to become ingrained. And this will be the target date. Months 3 to 4 middle phase, deeper work, challenging cognitive distortions, developing assertiveness and boundary setting skills, and beginning to focus on strength and self-esteem building. Isabel will be practicing these skills more independently between sessions. Okay, objective 3. It says um the 12 weeks, Isabel will integrate at least one stress reduction activity into her weekly routine that's unrelated to work, fostering a healthier balance and addressing her solution. This will be intervention, cognitive behavioral therapy, identifying and challenging anxious thoughts, helping Isabel identify negative or catastrophic thoughts, patterns associated with her anxiety. and this will be frequency. The frequency says building rapport and trust, establishing a strong therapeutic alliance is key. Frequent contact in the initial stages helps building rapport and trust, making Isabel more comfortable sharing and engaging in the therapeutic process. Date and then target date will be months 5 to 6 consolidation phase, consolidating learning skill, addressing any remaining significant obstacles, planning for relapse, preventing and potentially exploring more complex family or origin issues. If deemed relevant, this focus shifts toward sustaining progress and preparing for reduced therapeutic support. Goal 2. Goal 2, Objective 1. Okay, example 6 weeks. Isabel will identify three core personal strengths and value them, leading to 1 point increase on self-esteem rating scale. Intervention Intervention is a strength-based approach working with Isabel to identify her inherent strengths, past accomplishments, and positive qualities. This may involve using assessment tools or guided reflection exercises. Frequency consolidation of skills. At this stage, Isabel will have a good grasp of the core interventions. By weekly session, allow her to practice these skills more independently between appointments, fostering reliance. And then target date, consistent use of at least 2 to 3 anxiety reductions. Technique use. Example, deep breathing, mindfulness exercise in response to stressors. Objective 2. Date example 10 weeks. Isabel will practice assertively setting at least one boundary at work related to workload or deadlines, reporting a successful outcome or a learning experience from the attempt. Intervention is assertiveness training and boundary settings skills. Teaching Isabel specific techniques for communicating her needs and limits effectively, particularly in her workplace. This might involve role-playing scenarios to practice setting boundaries regarding workload, deadline, and overtime. Maintenance and table work. This is frequency. Less frequent sessions can be used to reinforce progress, explore more complex underlying issues like family of origin dynamics or deeper self-esteem work on relapse prevention. Target date. Sustained reduction in the frequency and intensity of anxiety-related physical symptoms, racing heart, chest pain. Objective 3. Date example 12 weeks. Isabel will demonstrate improved focus and time management skills by consistently meeting at least 80%. Her work deadline is for a 2 week period and identify one strategy to further enhance her focus. This will be interventions, time management and organizational skills training, providing practical strategies and tools for project management, task prioritization, and effective planning to improve her focus and ability to meet deadlines. This could include visual aids, digital tools, or structured planning methods. And this will be for frequency, Kyle and agency. It empowers Isabel by acknowledging her progress and allowing her more flexibility in her schedule, provided her ability is maintained. And then this will be time This will be target date. This will be rationally therapy. My transition to less frequent sessions, objectively, uh, bi-weekly, monthly, or as needed, to support Isabel sustaining her progress and navigating future challenges independently. So I think that was my presentation was about mock interview and it's done. Thanks for your listening and have a good day.